This video will show how to register clinical data on a patient in the Neurizon Neuromodulation Database. The clinical data form contains the details of the clinical condition for a patient, and the data you enter here will form the basis for all later registrations you do for this patient, be it procedures, outcomes, etc. The first field is the initiation date, also called the index date, and that marks the first day of a specific therapy for that patient. Usually, that would be the day of the first trial implant for this patient, but you can also manually set it to a different date, and this could be useful in case of a previously registered failed treatment attempt. The reason you are able to set this manually is that this date counts as day 0 for assessing which events or for which data that would be considered pre-treatment or baseline data and which would be considered follow-up data. The thing is that all forms have a date, and all forms with a date before the index date would be considered pre-treatment or baseline data, and all forms after that would be considered follow-up data. The core of the clinical data form is the indications, and you may add up to 4 different indications. An indication in this context is a condition that this patient is suffering from that is a potential target for neuromodulation treatment. It is important that the order does not necessarily depend on symptom severity, meaning that what you have registered as indication A may not necessarily be more severe than indication B, and never ever later change the order of the assigned diagnosis, because different diagnoses may incur different treatments and may have different follow-ups, and if you change the sequence of the indications later on, database will not know that all these forms all of a sudden belong to different indications. So stick to the sequence of indications that you originally made. Even if one indication is completely cured, just leave it where it is. If the patient starts suffering from something else, add that as a new indication. Also, for each indication category, there are a number of associated variables. Most importantly is the symptom debut, when the symptoms started. If the patient does not really remember, but it was some day in November 2007, enter that as mid-November. If it was some day in 1997, add that as mid-1997, for instance, the 1st of July. You can also add a date of the triggering event, what caused the symptoms. That may be, for instance, the onset of diabetes in case of diabetic pain, where there may be a long delay between the onset of the diabetes and the actual appearance of diabetic symptoms or diabetic painful symptoms, or for instance a surgical procedure in case of nerve damage. Also, if the disease has focal symptoms, you can add a localization. Importantly about these indications, if a patient has symptoms in 2 distinct areas, this counts as 2 indications even if they have the same origin. For instance, you may have a patient that has failed back surgery syndrome and has pain in the lower back, but also has radicular pain in the right leg. This patient will have 2 indications. Indication A could be back pain after spinal surgery in the lower back. Indication B could be radicular pain after spinal surgery in the right leg. The reason for this distinction is that you may treat these 2 different areas as different entities in terms of treatment paradigm, but they may also have very different treatment outcomes. Also, if the patient has 2 distinct symptoms in the same area, this also counts as 2 indications. For instance, you may have a patient with traumatic amputation that has stump pain and phantom limb pain, for instance, in the right lower arm. This patient will have 2 indications. Indication A may be amputation stump pain in the right lower arm. Indication B may be amputation phantom pain in the right lower arm. Even though this has the same origin, this still, in this context, count as 2 different indications. In the clinical data form, you may also add additional information such as comorbidity, that is conditions that may have relevance for the patient's treatment or for the patient's outcome. And also there is a field where you can note who referred the patient to you and on the date which the patient was the referral was registered, because this allows you to calculate the average time at your waiting list. Also, there is a free text field for describing relevant previous therapy. So, just to show in the actual database how this is performed, click first on the clinical data if not already there. And first you can choose the SCS or DRG, PNS, and so forth, the initiation or the index date of a therapy. Let's say that we use SCS. If you are in doubt on a specific field, remember that these little bubbles always offer help on various variables. Let's say that we start today, the 1st of August 2015, with SCS. You may go back here and change this later if you don't know the initiation date when you fill out the clinical data form. And let's take a patient with stump pain and phantom pain from before. This patient in the diagnosis category would be a pain condition. This opens up a whole new list of variables. The diagnosis in this case would be, let's say it was stump pain. Let's take a symptom debut that is about, let's say, 5 years ago in August. And the patient does not really remember when, so let's say that it was about mid-August. The triggering event date may be, let's say, even further back. It may be in 2008 sometime, and let's say it was just mid-year. So that would be the 1st of July 2008. The triggering event, let's say it was a traumatic amputation. The localization of the symptoms is in the right side. The painful area is in the upper extremity in the forearm. And here you can add various neurological symptoms such as spontaneous pain and various kinds of allodynia. But what I think is more interesting is, has this patient previously been treated with TNS or transcutaneous electrical nerve stimulation? Let's say that he has, and let's say that it had some effect on his, or had significant effect on his stump pain. But in this case, he also has phantom pain, which means he has an indication B also. Again, it's a painful condition. The diagnosis in this case would be phantom pain. And the symptom debut may or may not be at the same time as the stump pain. Let's say that it was actually of new origin from, let's say, 2012, and he does not remember, so it's say about mid-August. The triggering event date, that would of course be the same. Let's see, that was 1st of July 2008. So the triggering event, because it was still the traumatic amputation, would be the same date. Here we go. Here you may or may not add the same text, again, depending on how lazy you are. And the localization, again, this is the right side. It is still in the upper extremity below the elbow. But as this is two different entities, this patient may also try a TENS for his phantom pain. But in this case, it is very unlikely for this treatment to have had any effect. Again, under comorbidity, you may add other things you think is relevant for this patient's condition. Let's say he may have depression and he may have alcohol dependence. What I think is extremely interesting is also, did this patient have a previous chronic pain condition? In this case, we define it as a condition lasting for more than 3 months, requiring treatment, and it's not directly related to the current condition. It could be chronic headache and so forth. If you press yes, I suggest that you specify here in the free text field other notes for the clinical data. This drop-down menu of referrers is a table that the national administrator can edit. And here you just add the date. Let's say that this patient was referred to us about 2 months ago, and this will enable us to calculate our waiting list. Here's a free text field for any previous therapy you may find relevant, and here you can add any free text notes. Press save. and you see how the personal data field is updated, and you can, as always in the Neuromodulation Database, go back and revise your data by clicking on the timeline.